Okay, it's now my pleasure to introduce our keynote, or our keynote introducer. I'd like to ask Dr. Andrew Bond from the Canadian Network for the Health and Housing of the Homeless to come up on stage to introduce our keynote speaker. Dr. Bond.
Hi, everyone. Like all healthcare providers working with and for people experiencing homelessness, I have the responsibility of accounting for and responding to the fact that the average age of death of people on the streets in Canada is less than 50 years. That's more than 30 years less than the average life expectancy. Almost universally, the health problems that are besieging people experiencing homelessness are born out of the deep relationships that are reciprocal between our lived environment, our bodies, and our minds. That's why I'm happy to share with you today that last week, with the unwavering support of the Canadian Alliance on Homelessness, we've launched the Canadian Network for the Health and Housing of the Homeless, or CAEH19. CAEH19, thank you. CAEH19 will bring together the healthcare and the homeless sectors to help figure out how to develop a health-informed end to homelessness and to provide a platform at a national level for the critical intersectoral work that needs to happen in order to drive the change that we all know needs to happen together in a collaborative way. Now, out of all of the major problems and challenges that exist at the interface of housing and health, the opioid crisis we know looms large. We all know just how bad it is. I think, and I suspect that very many of us, if not most, have been either personally or professionally touched in ways that are deeply impactful. However, there are strategies that are capable of turning things around, and that is why it's my pleasure today to invite and welcome my friend and colleague, Dr. Eileen de Villa, Medical Officer of Health from Toronto, to talk to you about, and to all of us about, the public health strategies that we know can bring an end to this opioid crisis. For me, she embodies the very difficult balance between outrage, passion, and courage with rigorous deployment of evidence and skillful public service that are required to create a navigable path forward. Please join me in welcoming Dr. de Villa.
Well, good afternoon, everybody. Thank you for that. Andrew, thank you for your very kind words. And thank you to the organizers of this event for allowing me to be here. I am truly, truly honored and very, very pleased to be here at this national conference on ending homelessness and to participate in this very important dialogue on a complex and important issue. So as you've heard, my name is Dr. Eileen de Villa, and I'm the Medical Officer of Health for the City of Toronto. In this capacity, I have the honor and privilege of leading Toronto Public Health, Canada's largest local public health agency. Comprised of almost 1,900 staff, working across more than 30 different locations across the very big city of Toronto, it is Toronto Public Health's role to provide public health programs, services, and functions to all 2.9 million residents of the City of Toronto. So those of you in the room probably know that the primary objective of public health is to actually improve the health status of the population. This being said, I believe that we all have a role to play in improving population health. And I believe that individually and collectively, we are much more powerful than we might initially think. One of the ways in which we can achieve this important objective of improving population health is through conferences, just like the one that we're at today, as this provides an opportunity for us to share information on the successes and lessons learned in our experiences from one jurisdiction ideally to benefit those from many other jurisdictions. Today, I've been asked to talk about the opioid poisoning crisis, a topic that I believe is the defining health crisis of our generation. In my talk, I'm going to share with you some actions that we've taken in Toronto to address this opioid crisis, some lessons learned, and some recommended actions. But let's go back to the beginning, at least the beginning for me. I first started this job as medical officer of health for the City of Toronto in the spring of 2017. And with that came a whole sort of feeling of excitement, right? Just picture, you're practicing, an area, your profession that you've studied a long time to be able to do. And not only are you doing the work you love, but you're doing the work for the city in which you live, the city that you love. That's where I found myself in the spring of 2017. But shortly thereafter, that feeling of excitement gave way to grave concern. Grave concern because I realized soon after joining Toronto Public Health that we were facing the defining health crisis of our time. A crisis which demanded immediate action. And I started to think back to the examples of other health crises from the past and what kind of impact they had on population health. So for example, in 1952, we know that polio caused the death of over 3,100 children in the United States. In 1995, the worst year in the fight against HIV in Canada, about 1,750 people died from AIDS. And in 2003, we know that there were 44 deaths across Canada due to SARS. But now we find ourselves facing a new public health crisis. But this time, it's not a communicable disease that we're dealing with. In fact, there's been an alarming rise in opioid-related deaths in Canada. The majority of these deaths have been accidental and have increasingly involved potent opioids, including fentanyl and fentanyl analogs. In 2018, more than 4,500 Canadians died from an opioid overdose. 4,500 Canadians. This means that one life was lost every 2 hours related to opioids. In Toronto alone, over 300 opioid-related deaths occurred in 2018, and this is more than double the number from 2015. Simply put, too many people are dying, and these deaths are preventable. We know this issue is having a devastating impact on people in our city, as it is in other jurisdictions around Canada and throughout the United States. And we know that this issue knows no boundaries, not income, not race, not geography. Opioid overdose is now the leading cause of preventable death in Canada for people between the ages of 30 and 39. And in British Columbia, the epicenter of our country's opioid poisoning crisis, in 2018, life expectancy has for the first time in decades actually gone down. And if current trends continue in Toronto and in other parts of our country, we will also be facing the same grim reality. We will be living shorter lives in 2019. Too many people are dying, and these deaths are preventable. In Toronto, as you've heard from my colleague Andrew, we do have a comprehensive action plan which is guiding our response to this crisis. And this plan was actually developed in consultation with a broad range of community partners, adopted by our Board of Health in March 2017, and was recently updated again just this past June. The strategy, the plan, actually involves 10 specific strategies, 10 broad strategies that actually has specific actions directed towards all levels of government. And the focus of this plan is on prevention, harm reduction, and treatment interventions. And there are 10 key areas, as I've mentioned, in respect to the plan, and I'm just going to quickly take you through these 10 key areas. First, it articulates the need for governments to have a comprehensive overdose plan. The plan also states our belief that governments should support separate, Indigenous-led processes to develop action plans for Indigenous communities. And I can tell you that in February of this year, the Toronto Indigenous Overdose Strategy was released and approved by the Toronto Board of Health. The second key area involves equipping people in the community with the knowledge and tools to prevent and respond to overdoses. This includes things like the distribution of naloxone and overdose recognition and response training on a more broad basis. Third, working with first responders to address barriers to calling 911 during an overdose, as people are often afraid to call 911 for fear of police involvement at the overdose scene. The good news here is that we now have Good Samaritan legislation which aims to protect people from arrest for drug possession at an overdose scene. Number 4, adding supervised consumption services to existing health services as part of the continuum of healthcare. Number 5, the need for drug checking services, which allow people to test their drugs or to have their drugs tested before they consume them. The tests provide important information on the contents of the drugs, which can include dangerous toxins, as well as unexpected drugs, which can contribute to the risk of overdose. I can tell you that a new comprehensive drug checking project was recently launched in Toronto, and we will be sharing its outcomes as they emerge from this project. Number 6 refers to the need for access to on-demand treatment options. In Toronto, people have reasonably good access to opioid substitution treatments, such as methadone and Suboxone. However, access to other kinds of treatment, including withdrawal management and residential counseling programs, often have extremely long waiting lists. We also need to add managed opioid programs, such as injectable and oral hydromorphone, to the slate of available treatment options. The key priority here is to move people out of the toxic illicit drug supply. And these kinds of programs, managed opioid programs, help to do just that. Number 7, to support efforts to reduce overprescribing in the first place and to support people who may have already become dependent. We know that many people have become dependent on pharmaceutical opioids after being prescribed these medications for a variety of medical conditions and issues. And if people don't have access to pharmaceutical drugs, they may turn to the unregulated illicit market and more dangerous drugs. And in fact, research and community experience has actually borne this out. Number 8, in order to effectively respond to what's happening in the community with respect to overdose, fundamentally, we need good data. We continue to work hard in Toronto and beyond to get better and more real-time data. I can tell you that in Toronto, we have an online tool, the Toronto Overdose Information System, and this tool includes regularly updated information on opioid deaths, paramedic calls for suspected overdoses, emergency room visits for overdose, and it also has information regarding the use of our supervised injection service at Toronto Public Health. Number 9, we're getting there. Many of our actions and interventions focus on responding to the crisis, which is absolutely critical. But we know we also need to focus on more upstream approaches. In particular, and I'm sure this won't be lost on this audience, we need to address key social determinants of health. Determinants like affordable housing, adequate income, supportive housing, to help reduce risk factors for problematic substance use, as well as mental health issues and homelessness. Addressing our affordable housing shortage and reducing poverty are clearly long-term efforts. And Toronto Public Health is absolutely working with city and community partners to do this work, and I suspect we'll be doing that for quite some time. And last but not least, number 10. And this last strategy also highlights the importance of prevention and the need for a fundamental shift in our drug policy. Simply put, our current approach of criminalizing drugs and the people who use them has reduced neither the demand nor the supply of drugs. I will thank you for that, but there's more. There's more to come on that. I will speak about this a little bit further, but before I do that, I just want to tell you about one of our more recent initiatives that's just been developed in Toronto. So as part of our efforts to increase collaboration and integration on this particular issue, we recently established a task force with the Toronto Academic Health Sciences Network, which is a mouthful in and of itself, but suffice it to say that it includes all the local teaching hospitals within the City of Toronto, the academic centers of medicine. So in addition to Toronto Public Health and this network of Toronto teaching hospitals, the task force that we've recently developed also includes community health service providers, and it includes, importantly, people who use drugs. The goal of this task force is to develop an evidence-informed approach to improve the health outcomes of people who use drugs, and in particular, people who are at high risk for overdose. So the plan is that we will include integrated services, whether it's at teaching hospitals, at Toronto Public Health, and at other community service providers in their locations to improve care pathways in all the many directions that we know they happen. So to and from community service settings, to and from emergency rooms, to and from inpatient care. What we're hoping to do with this collaboration is to leverage and to build on existing services and infrastructure, while also improving and expanding access to treatment options and health care for people who use drugs. Perhaps, Tim, you'll invite me back next year and I'll tell you about how it's going. I mean, it is just getting off the ground now, but we're extremely hopeful about this and really are interested to see what we can do better together in terms of improving pathways for health. But getting back to my original point, overall, the opioid poisoning crisis highlights historic and systemic failures of our approach to drugs, and in particular, the criminalization of people for using drugs, and the vulnerability of the unregulated illicit drug market to issues such as contamination. So as many of us here in this room and beyond continue to work to address this crisis, we need to keep asking ourselves, why are we not paying more attention to this devastating issue that is affecting so many of our communities? if an airplane with 300 passengers on board crashed and all lives on board were lost, I'm certain, I am absolutely certain, that there would be no shortage of empathy, no shortage of sadness, and no shortage of action. In Canada, our country, the opioid poisoning crisis is claiming the equivalent of a fully loaded commercial airplane every single month. So why are we not doing more? Why are we not paying more attention? I think the answer takes us back to 1971, when then US President Richard Nixon described drug use, declared drug use, to be public enemy number one. This effectively marked the start of the war on drugs. And ever since then, we, as a society, have tended to view people who use drugs, especially drugs like opioids, as criminals, as morally flawed people who choose the wrong path again and again. In reality, we don't really know how many people are struggling with opioids. But we do know that these people, well, they're our friends. They're our family members. They're our neighbors. And they are our colleagues. And the paths that led them to problematic drug use are complex. They're not just simple choices. For example, there's the young emergency room doctor who had an amazingly successful career. He became dependent on fentanyl after a back injury and lost everything. And there are people who are struggling with childhood trauma, trying to deal with adverse childhood experiences. And they may find themselves self-medicating with opioids simply to get through the day. People from all walks of life take drugs. I'm going to say that again. People from all walks of life take drugs. When you have a headache, you might take a Tylenol or an Advil. When you're sick, you may go to your doctor and get a prescription for antibiotics or some other medication. When you need a pick-me-up, after a lunch, at a conference, you might have a cup of coffee or a cup of tea. And at the end of a long day, you may have a glass of beer or a glass of wine to relax. Drugs have been around, and in many instances have been accepted for most of our history. But people who use illicit drugs face significant stigma from their family members, from their friends, and from society at large. And the thing is, the definition of which drugs are legal and which ones aren't isn't actually based on the risk of harm associated with using those drugs. I'll remind you that alcohol was prohibited here in this country and in the United States about 100 years ago. And it's not like the law was changed because alcohol all of a sudden got safer. In fact, while alcohol is legal, it is a drug that causes significant harm in our communities all around this country. Everything from collisions associated with impaired driving, to a variety of cancers, to increased incidents of violence. And these are just a few of the harms associated with alcohol. The bottom line is that all drugs have the potential to cause harm. But the potential harms associated with drugs are worsened when people have to produce, obtain, or consume those drugs illegally. It's my opinion and my strong belief that our drug laws push people into unsafe behaviors like using alone, and they prevent people from seeking help out of fear of judgment, fear of getting in trouble, fear of being arrested, fear of losing everything. Experience from around the world has shown that making drugs illegal does not stop people from using them. People have always used drugs, and they will continue to use drugs. We need to acknowledge this reality, and we need to focus our efforts and our attentions on what it takes to keep people safe. Despite trillions of dollars, trillions with a T, spent on the war on drugs, the global illegal drug market continues to grow and has an estimated value of somewhere between $430 billion and $650 billion US dollars every year. We also know that countries that have the strictest laws or the harshest enforcement approaches to drug use aren't winning the war on drugs either. So enforcement doesn't work. And the tools in our current toolboxes, the ones we've been using, they're not working either. So, what can we do? First, I think we need to admit that we have lost the war. We need to raise the white flag so that we can start to think differently about this crisis. We need to take a more compassionate approach. We can start to recognize that neither drugs nor the people who use them are the enemy. Drugs are a part of our society. For some, it might be legal options, like the caffeine on the table there, tobacco, alcohol, and more recently legalized, cannabis. Others may use different substances. But fundamentally, I believe that we will do better in the face of this crisis if we drop some of the arbitrary moral distinctions that we make. Drugs are drugs. They have been with us forever, and they always will be. Rationalizing which ones are good and which ones are bad is simply not productive. As a public health physician, my advice is that we need to treat problematic drug use as a health issue, not a criminal issue. And there's reason to think this way, not just because you're clapping, right? There's actually evidence that supports this. We know that countries that have decriminalized personal drug use and possession, countries that have invested in public health interventions, have actually seen positive results. For example, since decriminalization, Portugal has seen a reduction in drug use amongst vulnerable populations and increases in the number of people seeking and accessing treatment. They have also seen significant decreases in drug-related deaths. This is why we at Toronto Public Health, we sought our public's input in 2018 about Canada's current approach to drugs. We actually held community discussions on what a public health approach to drug policy could look like. Through this process, we learned that Torontonians do not believe that the current approach to drug policy is working, and they are supportive of drug use being treated as a public health and a social issue, not a criminal one. Participants in our public consultation also expressed the need for our health system, for our health care system, to scale up prevention, to scale up harm reduction, and to scale up treatment services to ensure that we can provide the supports that people need. Last year, as you know, it became legal for adults to purchase cannabis for personal use in Canada. Some health officials and others are calling for similar changes in our approach to other drugs, especially as we face the current opioid poisoning crisis. Too many people in our communities are dying from drugs in the illegal market, which are contaminated with fentanyl and other potent substances. And we know the resulting trauma is devastating. It's devastating to people throughout our communities. So how do we take a different approach? What might this look like? Well, I think we can start by decriminalizing the possession of drugs for personal use. Fear of prosecution and fear of stigma drive people who use drugs into unsafe places where they overdose alone, or into situations where the people around them fear calling for help for fear of arrest or other significant consequences. This is why I recommended to Toronto's Board of Health to advocate for the federal government to take a public health approach to drug policy that includes scaling up prevention, scaling up harm reduction, and scaling up treatment responses. The public health approach that we're calling for also includes the decriminalizing of the possession of all drugs for personal use. I also recommended that the Toronto Board of Health call on the federal government to strike a task force to explore options for the legal regulation of all drugs. I'm happy to say that the Toronto Board of Health endorsed these recommendations, as have other health boards beyond Toronto's. So we're getting there. We know that there are other strategies and other approaches that can help. So let's learn from the experiences of other countries and other jurisdictions that have had greater success. Let's invest in prevention. Let's increase access to a range of treatment options. Let's provide harm reduction services to support people who are actively using drugs. Let's invest in supportive and affordable housing and poverty reduction measures to improve people's lives. And let's change our drug laws to reflect the fact that substance use is a health issue and not a criminal issue. So with that, I will thank you for providing me this opportunity to speak with you today. I hope you found this helpful, because I believe that sharing information about the opioid poisoning crisis is a real opportunity for us to contribute to increased understanding about how we can work better together to create meaningful change and ultimately healthier communities. Thank you very much for your attention.
You know what I love about this presentation, what Dr. de Villa had to say, is in addition to what she had to say, she's being very brave in her position and speaking truth to power and challenging public officials and our elected leaders to do the right thing and to change the law as needed to prevent this preventable crisis. And we each have a role, and we each have an opportunity as voters, as citizens, as leaders, to take some action to prevent this preventable destruction of life.